patients with a large vessel occlusion and minor symptoms are quite frequent. Most of the patients with a large vessel occlusion have severe symptoms, but many of them also have low NIHSS. And typically in this situation, there is here again no proof that the endovascular therapy is beneficial as compared to medical management alone. And several observational studies have compared EVT-treated patient and medically treated patient, and have shown that clearly there is no difference between the two treatment groups. But this is non-selected studies, and probably some of these patients will have an important benefit of endovascular treatment, and some of these patients will not have any benefit and potentially have some harm from endovascular treatment. And so the study we made aimed to select the good patient for endovascular treatment, and the first thing we did is that we studied the group of patients treated with intravenous thrombolysis alone. So the patient did not receive endovascular treatment, and we would like to focus on how frequent was the early neurological deterioration in this population, because the patients have a large vessel occlusion and a low NIHSS, so they have a risk of worsening in the first few hours, and this risk was not very high. It was around 15% following IV TPA, and importantly, we found very important markers on imaging that may help to determine on patient admission which patient will worsen in the next few hours. For typically the patient with the most proximal occlusion have higher risk of deterioration, and also the patient with longer thrombus have higher risk of deterioration. So typically if we take this patient with long thrombus and very proximal occlusion, the risk of deterioration following treatment IVT alone is very high, and potentially this population could be a good population to be treated with endovascular therapy, or at least this is the best population to study in randomized controlled trials. If we include all these patients with minor symptoms and large vessel occlusion in a trial, it is highly likely that the trial will be negative or neutral, and to increase the risk of positive finding, we should focus on a much selected population, because clearly the treatment effect of EVT in this population is much lower than in patients with more severe symptoms.